First of all, Sam, you have to listen to your own body. Our bodies are designed in a way that gives us signals something is wrong.
Hi everyone, I'm Samantha Purvor and welcome to another episode of Let's Talk Wellness with Watsons. I'm super excited for today because today's topic is all about women's reproductive health. Tamang-tama because I think it's about time that we talked about it, lalo na yung important stages of women's health and how they affect our overall well-being. But before we get started, don't forget to like our Facebook, follow us on Instagram and TikTok, and subscribe to our YouTube channel for the latest in health and beauty tips. Don't forget to hit the subscribe button to stay updated. Our guest for today is a board-certified obstetrician, gynecologist, and reproductive medicine specialist, also an advocate for women's health, Dr. Cialuj Agbayani-Cruz. Welcome, Doc Cial.
Hi, Sam. Hello, everyone.
So, Doc, I'm actually very aware that discussions about women's reproductive health can be very sensitive. As a matter of fact, it may be considered taboo, especially here in the Philippines. So to start off, Doc, what is women's reproductive health and why is it so important to discuss?
Women's reproductive health encompasses the physical, emotional, and social well-being of women throughout their life stages, focusing on the reproductive system. So that's majority of a woman's lifespan. The key areas of concern for reproductive health include menstrual health, fertility, contraception, pregnancy, childbirth, and let us not forget menopause. It's important to understand these stages so we can also get a clearer picture of our overall well-being.
Menstrual health, hormones, pregnancy, and all of these are unique to a woman's health. Now, how exactly can I support my body through these stages?
Okay, first off, Sam, regular and healthy menstrual cycles reflect a proper functioning body's endocrine system and reproductive organs. On the other hand, irregularities may reflect that something is wrong with your hormones. So, let's go to the hormones now, no? First is the estrogen. It supports yung lining ng matres. Pag marami kang estrogen, kumakapal yung lining ng matres kasi i-prepare niya yon para sa pagbubuntis. Yung second naman, progesterone. Tutulungan din niya yung estrogen na pakapalin yung lining ng matres mo para pag may na-fertilize na egg, doon mag-i-implant para sa pagtubo ni baby. Pag may mga hormonal imbalances, pwede niyang i-disrupt yung menstrual cycle. So, it is important to keep them in check. We can do this by proper nutrition and even through supplementation. First is magnesium. Magnesium is an essential nutrient that can help manage menstrual cramps. Second is vitamin B6. It helps with premenstrual symptoms. Iron is a supplement that will help prevent iron deficiency anemia.
Grabe, Doc, that's just one stage of our life, our menstruation. What are some changes that we should know during pregnancy?
So, in pregnancy, the body now adjusts to support a developing baby. These changes facilitate a healthy growth for the baby and prepares the mother for childbirth. Some significant physical changes include weight gain, breast changes, and the growth of the baby bump. Other physical changes include stretch marks, darkening of the skin. No? Some patients experience it on the face, on the abdominal area. There are some patients, they also experience pamamanas ng mga paa at mga ankles and hands. This is due to fluid retention and changes in blood circulation. Also, as the baby bump grows, the center of gravity shifts. So if you ask your friends, they already complain of back pain, they're already prone to slips or risk for falls. Varicose veins can also develop due to an increase in blood volume and pressure on the veins in the legs. Kasi pag lumalaki na, naiipit na yung drainage ng veins. Aside from all those physical changes, pregnancy is also an emotional journey. So imagine the fear or disbelief at the start, knowing that you got pregnant, and then the anticipation and the anxiety of going through a journey that you don't know yet. So even pregnant women, they need our support.
How about supplementation, Doc?
First is folic acid. Folic acid helps prevent abnormalities in a developing baby, specifically with the brain and the spinal cord. Number 2, iron. Pag naging buntis ang isang babae, nagiging malabnaw ang dugo. Pag nagiging malabnaw, nagiging anemic, hindi nakakapuntay lahat ng mga nutrients sa anak. With iron, nag-i-increase po yung blood production ng impact RBCs or red blood cells para makatulong na makarating sa bata yung mga nutrients na to. Number 3 is calcium. Calcium is essential for the development of baby's bones and teeth and helps protect the mother's bone density. Hindi lang sapat na may calcium kang iniinom. Vitamin D helps with calcium absorption and is also important for bone health and immune system function.
It's truly mind-blowing how complex our bodies are and eye-opening to realize that many women might be dealing with common health issues, especially PCOS or perimenopause. Can you tell us more about this, Doc?
So first, let's talk about PCOS or polycystic ovary syndrome. It is a hormonal disorder when the male hormone in your body as a female overcomes your female hormones. Irregular menses because you're not ovulating, you're already giving out those male androgenic symptoms. Acne is number 1. Number 2, baldness or hair fall. Number 3 is also upper lip hair or areas in your body that is more hairy than usual. Check your legs, ladies, okay? It affects approximately 1 in 10 women of childbearing age and is one of the most common hormonal disorders among women. PCOS is also associated with cardiovascular diseases, metabolic syndrome, and most especially depression and anxiety. Perimenopause refers to the transition period leading up to menopause, during which a woman's body undergoes significant hormonal changes. This period can last for about several years, typically beginning in the woman's mid-40s, but it could start earlier. Symptoms of perimenopause could include irregular periods, hot flushes, sleep disturbances, mood swings, and changes in sexual function.
Wonderful that we're talking about the different stages of a woman's life. However, how about the small things, the everyday habits, the food that we eat? Do they have a direct impact on the overall health of a woman?
All those small things, they affect your reproductive health. So, we have to maintain a healthy weight. Actually, women with polycystic ovary syndrome, you just have to lose 5 to 10% of your current weight, and you can also already have your regular menses by then. Number 2, we have to eat healthy. I always tell my patients there are a lot of hormone disruptors now in our environment, especially in our food. Please choose food that are non-processed and are non-preserved. Package your food in non-plastic containers. Ideally, choose glass or ceramic, okay? And number 3, you have to exercise regularly. You have to take note, 30 minutes minimum to maintain the weight, 45 minutes minimum to lose the weight. Number 4, please do not forget to do your regular checkups and screening tests, especially your blood pressure, your cholesterol levels, and your sugar levels for diabetes prevention. We have to manage stress by practicing yoga, meditation, mindfulness, all these to help reduce the stress. Avoid smoking and limit your alcohol. This includes vaping, guys. Another thing to watch out for is obesity. Obesity is defined as having a body mass index of 25 or higher. Body mass index, yan po yung tinitignan namin, yung height nyo po ba, okay po ba sa bigat ninyo? Or vice versa, yung bigat mo ba, okay pa sa height mo? Excess body fat can contribute to a range of hormonal imbalances. Yung taba, nako-convert po kasi yan to hormones. Obesity can also cause health issues for women, including insulin resistance, irregular menstruation, heavy and painful menstruation, fertility issues, pregnancy complications, and a higher risk of endometrial cancer.
It's fascinating how all these small things, Doc, add up when it comes to women's reproductive health. What are some effective strategies that we can advise to all of our women listening so that we can empower ourselves and each other?
First of all, Sam, you have to listen to your own body. Our bodies are designed in a way that gives us signals something is wrong.
Yes.
Something is not right. You have to adjust something. You're not sleeping right. You're not eating right. Once you know those clues, visit your obstetrician gynecologist. Kala mo inaantok-antok ka lang sa work, yun pala hormonal imbalance na. And lastly, please start tracking your menses. Ilan sa inyo ang nagtatrack ng menses? Ilan sa inyo ang nalalaman kung regular sila or hindi? Baka kayo hindi. Start making use of technology. There's a lot. You can read about polycystic ovary syndrome. You can read about infertility. Just approach your OBGYN and we are very happy to be of help.
Just imagine the strength and the confidence that comes from knowing what's best for your body. I can't thank you enough, Dr. Cialuj Agbayani-Cruz, for sharing your knowledge with us here for today.
Thank you for inviting me, Sam. And for a closing, please check on your female friends, female family members. Thank you so much.
We do hope that you guys enjoyed and learned a thing or two about women's reproductive health. And to help us remember our discussion from earlier, joining us is one of our Watson's pharmacists. Let's welcome Miss Junelli and Lorette. Hello!
Hello, Sam. Thank you so much for inviting me.
Nakarelate ka ba kanina sa mga topics?
Yes, the specific topic that resonated with me would be the list of supplements and vitamins that a pregnant woman could take during her pregnancy, and also the list of vitamins and supplements that a woman who is having a heavy menstrual period. This is very important in my profession as a pharmacist so that I could properly counsel my patients.
Now let's play a game. This game is called Never Have I Ever. So the first statement is regular gynecological checkups. I have. How about for pap smears? I have.
Never. It is a screening for cervical cancer.
Breast self-examination. I have.
It is a visual and physical examination for early detection of breast cancer.
Regular intake of iron or folic acid. I have. Regular checkups for blood pressure, sugar levels, and cholesterol. I have. Preconception health check. I have never.
I have never also. This is overall health check-up for women who is planning to have a baby.
Thank you so much, Janelle, for sharing your women's health checklist with us.
Salamat, Sam, for having me as well.
And to us, na mga kababaihan, always remember that we have the power to choose and decide over our bodies. And luckily for us, Watson's has a wide range of vitamins and supplements to help us achieve our health goals. Get them through the Watson's app or at 1,000 plus stores nationwide.
For more information about vitamins and supplements, don't hesitate to ask your Watson's pharmacist.
Taking care of your reproductive health is essential for your overall well-being. At Watson's, we have a variety of products that can support you at every stage of womanhood. Watson's Evening Primrose Oil Soft Gel Capsule provides you with a gentle and effective way to get rid of premenstrual syndrome or PMS discomfort. Watson's Ferrous Sulfate plus Folic Acid Tablet helps our body produce iron and maintain new cells to prevent iron deficiency. Neurogen E has vitamin E and B complex that help keep our body running smoothly. Myra E helps keep your lovely self beautiful inside and out with rich antioxidants from vitamin E. Watson's Calcium Plus D3 helps make our bones sturdy, while vitamin D helps keep our muscles and joints healthy. Femoral Recharge supports your emotional well-being by regulating your hormones and preventing emotional challenges that come with menopause. Now, calcium and magnesium helps your body functions run smoothly and also helps you maintain strong and healthy bones. Now, CoQ10 contains omega-3 fish oils, which is a superfood for your heart, ensuring it functions well and keeps your immune system balanced and supported. Puritan's Pride CoQ10 keeps your heart in top shape. It also has Q-Sorb, which is loaded with antioxidants that prevent cell damage and heart diseases. Puritan's Pride Folic Acid is your go-to for pregnancy support and overall wellness. It is rich in folate, so it also makes sure your heart and nervous systems are always in excellent condition. Take care of your reproductive health with Watson's. I'm Samantha Purvor saying, for women's wellness tips, find it at Watson's.